Let's get into this AC joint. There's a lot of ground to cover. We're going to start with the anatomy of it. AC joint is one of 4 joints that comprises the shoulder complex. The AC joint is formed by the junction of the lateral clavicle and the acromion, but we're still going to get into some of the clavicle. Yeah, I'll let Bobby do that in a second. It's a gliding plane style synovial joint. There's a little capsule in the middle. But anyways, the AC joint attaches the scapula to the clavicle and serves as the main articulation that suspends the upper extremity of the trunk. The main functions of the AC joint is to allow the scapula additional range of motion. On the thorax, it's one of those 4 joints, so it adds an extra lot of movement. We'll talk a little bit more about the movement in a second. It allows for adjustment of the scapula, the tipping internal and external rotation outside the initial plane of movement in the scapula as movement of the thorax and arm occurs together. The joint, really what it does is allow transmission of forces from the upper extremity to the clavicle, which presents problem because it's not a robust joint, right? Go into the clavicle really quickly in terms of the anatomy and stuff, and then I'll go back into the AC joint. But like the transmission of energy back and forth, that's what all joints are really doing. We talked about that one with Dr. Spina. Very quickly, go ahead and give me the clavicle stuff before we go back to the specifics.
Well, comes off the manubrium, right? Goes to the acromion. Muscular attachments would be subclavius from underneath. We have an SCM. We have a pec major. Certain fibers coming off of, I think it's the proximal third, where the subclavius is more the middle third, anterior, inferior part. I think there's just some deltoid and upper trap for sure fibers on the distal third on the superior edge.
Right.
We have that odd shape of the clavicle, which also helps, absorb force and anchoring and different things like that. It's got that little S shape to it.
What is that line? So it attaches to the manubrium. I want to say it's the angle of Lewis. Do you know what I'm talking about?
Yeah.
Where the bottom of the manubrium, the horizontal plane cuts back to the same T3 of the scapula. So where that movement should be kind of symmetrical and lined up, those angles kind of coincide, if I'm correct. Yes? Okay. Bobby's shaking his head. We're just going to blindly agree. But okay, so moving in from the clavicle, starting with some of the ligaments, because some of those ligaments do start out on the clavicle, probably the inner third of the clavicle, right? You'll have your coracoclavicular ligament, which is comprised of the conoid ligament, which is a little bit curved. So it comes off the coracoid process and attaches to the conoid tubercle, obviously. Then you've got, moving a little bit more laterally, you've got your trapezius ligament. That's a little bit closer. What's that?
Trapezoid.
Wow, I can't speak today. The trapezoid ligament. Yeah. And then the third ligament is the coracoacromial ligament, which goes from the coracoid to the acromion. It's a weird one. I want to get into this at the very end, but it doesn't really stabilize the AC joint because it's attached from the scapula to the scapula. We both have some theories as to what is going on with that ligament, but it really doesn't hold anything. Well, it does hold stuff, but it doesn't really hold. It goes from a bone to a bone. That's a weird one. And then, of course, you've got your acromioclavicular ligament. Inside, you have an articular disc to that. And then I guess we can move down to the subacromial space.
Yeah, just basically the distance between the clavicle and the coracoid process is in general 11 to 13 millimeters or 1.1 centimeters to 1.3 centimeters. And a lot of times clinicians or doctors will use that number to distinguish the amount of displacement. You can obviously see it, but sometimes by measuring it, you can kind of see the degree to often the superior displacement of the clavicle. And often that distinguishes the difference between a type 3 and a type 5, where sometimes you'll have, for example, a much, much larger space there. And that indicates, different types.
No, and I know that there's often some degeneration that happens under that space. It can be either like a fibrous buildup or a degenerative process. I've seen things that say the degenerative process or the narrowing of that space has been seen to start in the second decade. So, I mean, is that your teens? That would be the start of the second decade. Yeah. And there is noticeable loss of that degenerative space, certainly at least during the 6th decade. So that kind of gives you a little bit of extra space, I guess, which is nice. How do we diagnose? How do you know you have a problem with the AC joint? Let's get into first some orthopedic tests with it. Yeah. There are clusters of tests that seem to be a little bit more effective at producing results that tell you something more definitively than one test at a time.